states in the United States are now on the travel advisory except Vermont. As a reminder, states go on to Chicago's travel advisory when they bypass more than 15 cases per 100,000 per day. That is also consistent with the CDC classification of being high risk for travel. So unfortunately, COVID is surging across the entire United States. The average right now is at 39 cases per 100,000 per day. We're doing much better than that here in Chicago, but nevertheless, the news remains not good from a COVID perspective at the national level. In that context, Chicago is also updating its advisory guidance to be aligned with some updated CDC guidance. So this is specific for people who are unvaccinated. If you are unvaccinated and traveling to a high-risk state, in line with CDC, there's a recommendation that you now get tested before traveling, 1 to 3 days before your trip. While you are traveling, as a reminder, regardless of your vaccination status, by law, you must wear a mask on all forms of transportation, public transportation nationwide, and we do recommend that you wear a mask in any indoor public setting, socially distance, and wash your hands. And then after you travel, in line with the CDC recommendations, the recommendation is now that you get tested 3 to 5 days after you travel, and again, only for people who are unvaccinated, that you stay home and self-quarantine for a full 7 days after travel. That applies even if you test negative. We still recommend staying home and self-quarantining for the full 7 days because we have seen and know that travel is a significant risk factor for acquiring COVID. If you decide not to get tested, the recommendation is actually to stay home and self-quarantine for 10 days after travel, and you should avoid being around anybody who's at increased risk for severe COVID outcomes for 14 days after travel, regardless of whether you get tested or not. Obviously, we want anybody who's traveling to self-monitor for COVID symptoms and get tested if you develop symptoms. Here's where we are in Chicago right now. We are currently averaging 473 cases of COVID every day right now. That leaves us in that high transmission risk category for cases, actually quite flat with where we've been over the last week, which I'm pleased with. I think having the masks on universally indoors has really helped slow that increase. Our test positivity also actually remains quite good. We're at 4.4% today. That was actually compared to 4.5% a week ago, and we've not crossed that 5% mark yet. Hospital beds and ICU beds remain just at the very upper edge of that lower transmission risk. We're currently averaging 248 COVID patients in non-ICU beds across Chicago hospitals and 99 in ICU beds across Chicago hospitals. I do expect both of those will likely move into the substantial transmission risk just as we continue to see people become infected, and especially if they're unvaccinated, get hospitalized with COVID. So our case count, as I said, remains over 400 diagnosed cases per day, but that increase has stabilized. A lot of attention right now on breakthrough cases. They are increasing, but I want to let you know that 99.9% of vaccinated Chicagoans still have not been diagnosed with COVID-19 after vaccination. You can see that at the first peak, we were averaging about 1,000 cases per day. That's when testing was not very widely available. We were averaging more than 2,500 cases a day at the peak in November. We're currently averaging between 400 and 500 a day. So if we do some comparison between what is happening for case rates among unvaccinated versus fully vaccinated Chicagoans, you see going back to early March, which was really the surge that we saw with Alpha and now the surge that we see with Delta, very heavily falling on those who are unvaccinated in red here versus fully vaccinated in blue. However, you see that even among those who are fully vaccinated, we are seeing some increase. And again, no vaccine is 100% protective. We are seeing some more of these breakthrough cases, and that's why the indoor mask mandate is in place. I do want to let you know that the highest COVID case rate is very much still among unvaccinated Chicagoans between 18 and 59. You can see on this chart here, these are unvaccinated Chicago residents. Our highest COVID case rate is in those between 30 and 59, followed by those 18 to 29. And then you can see quite a bit below that are our children and those over 60. We've been getting a lot of questions, obviously, as school is coming back into session. Chicago COVID cases do remain relatively low among 0 to 17-year-olds. It's that blue line on there. You can see really much lower than what we're seeing right now among people in their 20s, 30s, 40s, 50s. And we'll be watching this. We expect cases to likely increase in children, but broadly to mirror what we see at the community level. That's what we've seen previously. So if we turn from cases to hospitalizations, we're also doing reasonably well from a hospitalization standpoint here in Chicago. We're currently averaging 22 Chicago residents being hospitalized each day, compared to about 200 in the first peak and about 150 in the second peak. When we look at breakthrough infections, you heard me say 99.9% of vaccinated Chicagoans have not been diagnosed with COVID. Well, 99.99% of vaccinated Chicagoans have not been hospitalized with COVID-19 after vaccination. And if we look at, again, the breakdown between unvaccinated and fully vaccinated Chicagoans, in red again, this is the Alpha surge that we saw in March and April and the current Delta surge. Much higher rates among those who are unvaccinated. Right now in Chicago, about 5 times as likely to be hospitalized with COVID if you're unvaccinated versus fully vaccinated. And whereas the cases we're mostly seeing among unvaccinated people in the 18 to 59-year-old range, unfortunately, our highest COVID hospitalization rate is very much still among unvaccinated Chicagoans over 60. I can't say it enough. If you know someone who is over 60 and not yet vaccinated in Chicago, now is the time. On the left, you see here unvaccinated Chicago resident hospitalization rates by age. The gray represents people over 60 who are getting hospitalized. The green is people in that 30 to 59-year-old mark. And then on the right, the comparison is those who are fully vaccinated. So you can see in the breakthrough hospitalizations, more of those, again, are people in gray in their 60s, but the risk much, much higher among those who are unvaccinated. And then finally, deaths. We're currently averaging 2 to 3 COVID deaths per day here in Chicago, compared to about 50 COVID deaths per day at the first peak and about 30 per day at the second peak. So if 99.9% of Chicago residents have not been, who are vaccinated, have not been diagnosed with a breakthrough case, and 99.99% have not died, 99.999% of vaccinated Chicagoans have not died with COVID-19 after vaccination, remains remarkably protective against the hospitalization and death. And again, if we look at this comparison with the red showing rates among unvaccinated Chicago residents versus blue among fully vaccinated Chicago residents, at this time it's about people who are unvaccinated are approximately 15 times more likely to die in Chicago than those who are fully vaccinated. And the highest COVID death rate, just like hospitalization, is among unvaccinated Chicagoans age 60 and over. On the left, you see what our death rates look like by age. So that's unvaccinated folks. The light gray, again, is those over 60. The green is those in the 30 to 59, and then the younger people are lower. And then on the right, the comparison of those who are fully vaccinated by age. Again, where we are seeing people broadly be hospitalized or die from COVID who are vaccinated, in those rare cases, it does tend to be people who are immunocompromised or over 60. But getting vaccinated is by far the most important thing. We are still working on reaching both younger and then older Chicagoans. More than 60% of Chicagoans in all age groups over age 18 have now gotten at least a first COVID vaccine dose, which we're pleased about. And adolescent vaccinations continue to grow the most quickly. We're at almost 59% of our 12 to 17-year-olds have now gotten at least a first dose, and making good progress there. We have seen an increase in daily vaccinations. We're up about 15% from the low in July. We were averaging under 3,800 vaccinations per day in Chicago in early July, and we're now averaging more than 4,500 vaccinations per day, which is good to see. I think really pleased to see people make that decision to get vaccinated now. I know there were people who were waiting for the full FDA approval, which is now in place. I know there were people who were waiting to have more than a year of follow-up for people who were in the trials. We now have that. I know there were people waiting until there were billions of folks around the world who have been vaccinated. We now have that. We also, in the setting of the FDA giving the full approval, we are seeing more vaccination requirements related to work, education, et cetera. And so in that setting, I really encourage Chicagoans, if you've not made that decision yet, there's no shame in that. There's no problem with that. But please make the decision now. We want to keep you out of the hospital, and we want to help keep you from infecting others. And the best way to protect yourself and everybody else, is to get that vaccine. The majority of Chicago vaccinations, about 60% now, are happening in pharmacies. We're really pleased about that. There's a lot of capacity there, and especially as we look ahead to the potential of boosters, really having a strong pharmacy system in place is important. So I want to give a few congratulations to zip codes that have hit benchmarks. Zip code 60624, Austin, East Garfield Park, Humboldt Park, North Lawndale, West Garfield Park, had our biggest increase in first dose vaccine coverage for ages 12 plus since last week, so that was good to see. We also, 60620, which is Ashburn, Auburn Gresham, Beverly, Chatham, Englewood, Greater Grand Crossing, Roseland, Washington Heights, and West Englewood, crossed the mark where the majority, more than 50% of those over 12, have gotten a first dose of COVID vaccine. That's a really important benchmark for us as a city. You see, we only have 3 more zip codes to go to reach that important benchmark. And I'll be really pleased when we can say the majority of eligible Chicagoans in every zip code have been vaccinated. So we're keeping our focus on those last 3 zip codes, but really pleased to see 60620 hit that first benchmark. I also want to congratulate the 36 Chicago zip codes that now have 70% first dose vaccination coverage for ages 12 and up. And new this week, we've got 60634, which is Belmont, Cragen, Dunning, Montclair, Portage Park, and O'Hare, 60616, which is Armour Square, Bridgeport, Douglas, Lower West Side, and others, and 60615, Grand Boulevard, Hyde Park, Kenwood, Washington Park, and others. And we now have 10 Chicago zip codes that have crossed the 80% threshold. There are some countries like Denmark that have passed this threshold as a country at this point. I would love to see the entire map here blue, but when we start getting into the 80% eligible, I start feeling much more I have much less concern about major community-based outbreaks in those settings. So we've got 10 zip codes, and new this week, 60645, Rogers Park and West Ridge crossed that 80% threshold. So quick reminders here. First, a reminder to Illinois healthcare workers, school personnel, and students in higher education settings that under the governor's executive order, you're meant to be vaccinated by this weekend, your first dose. So as a reminder, the governor put this order out last week, and there were 10 days after that order to come into compliance. So by Sunday, September 5th, healthcare workers, education personnel, K through 12, and higher education personnel, as well as higher education students, and you can see the definitions here, are all meant to have that first dose, and then are meant to have the second dose if you're doing a 2-dose series within 30 days. So there certainly will start to be more consequences and more follow-up where folks have not done this, but please to avoid that setting. If you do work in healthcare or in education, or if you're in higher education, please take the opportunity even this week and save yourself some follow-up and trouble. I want to remind you, of course, that COVID vaccines are free and widely available. As I noted, you can walk into or make an appointment at nearly every pharmacy in Chicago. That includes the big chains, Walgreens, Mariano's, CVS, Walmart, Jewel Osco, Costco. It also includes many smaller pharmacies. Your own healthcare provider, in the great majority of cases, has COVID vaccine available. Really encourage you to ask and make an appointment with your doctor or with a pharmacist if you've got questions, particularly if you haven't gotten that first vaccine. Protect Chicago at Home continues to go very well. Reminder, all Chicagoans over the age of 12, you can register at chicago.gov/at-home or call 312-746-4835. And if you're in the city limits, we will make a vaccine appointment and bring it to your house. We are also happy to answer any of your vaccine questions at that hotline. And then finally, ZocDoc.com/vaccine is where you can make an appointment at a healthcare provider near your home. We also continue to have lots of community vaccination events. Tonight, for example, we're at the Noble Gary Comer Middle School. Tomorrow, we're at the Ellis Senior Center. Thursday, we're at Kennedy King College. Saturday, we've got another Vax and Relax at Carrie Ellis Salon in Roseland. And there are many more events on chicago.gov/vax calendar. So I encourage you to go there if you are interested in getting vaccinated at a community event. The Chicago indoor masking mandate remains in place. All individuals aged 2 and up, regardless of of vaccination status must wear a mask in all indoor public settings. I wanted to note that the Department of Business Affairs and Consumer Protection is definitely enforcing this mandate, including looking for signage and compliance. And just over this last week, they did issue 16 notices to correct and 20 citations to Chicago businesses that were not abiding by this mask mandate. So resources for businesses are available at chicago.gov reopening. If you're looking for downloads, you have questions, there are multiple webinars and outreach. But if you're a Chicagoan and you have a complaint related to COVID-19 and a business not complying, please call 311 or report it at 311.chicago.gov. And thank you to the huge majority of indoor settings in Chicago that are abiding by this. You are helping us keep this in control at this point. The last thing I wanted to note is an update to some of the work that the Health Department and Mayor Lightfoot have been doing on recognizing some of the indirect impacts of COVID. So in addition to the huge direct effects where we've seen so many people obviously get sick, be hospitalized, and even die in Chicago, we've seen major impacts on people's mental health. Big increases in terms of people seeking mental health care or perhaps having mental health issues but not seeking care. And so we've just launched this new campaign called Unspoken, which is meant to get at the fact that because of stigma, because of other reasons, we all may be having really thoughts and worries about mental health, but not necessarily speaking them. And the goal is here in Chicago to turn this into something that we talk about. So 45% of Chicagoans do think mental health support would be beneficial for themselves. 40% of Chicagoans feel mental health is one of the greatest challenges facing Chicago today. But only 42% of Chicagoans know where to get mental health support if they need it. So our goals of this campaign are both to address psychological barriers to mental health care, like stigma or people feeling like culturally they shouldn't talk about mental health challenges, but also structural barriers where people think, I can't afford it, I don't know where to get it, etc. And the goal of Unspoken is to address both of these. So we've launched just yesterday a new website, mentalhealth.chicago.gov. This new mental health resource website has multiple stories of Chicagoans talking about their decision to seek mental health care and raise up some of the concerns and some of the ways in which getting treatment did help Chicagoans. There's also a resource finder on here where you're able to find a care center near you. Every one of the care centers on here has public funding available and a sliding scale that goes all the way down to zero. So you can get free care or care that goes down to $0. And under Mayor Lightfoot, we've actually had a tripling of our mental health budget. And we've seen in 2019, City of Chicago resources helped serve about 5,000 Chicagoans with mental health care. And already this year, we've served more than 16,000. So already more than a tripling. And I expect we'll quadruple or quintuple that by the end of the year. And that's largely through investments in trauma-informed centers of care in 32 of the most impacted communities. So please, if you've got questions, there's information about symptoms, there's information about treatment, there's common questions, and then there's resource finders that are meant to be no barrier. So cost, immigration status, insurance status, not a barrier to the places that are available on this site. And with that, I'll bring up Dr. Luna, Medical Director at CDPH, to give a brief update in Spanish, and then I'll come back and take questions.
Thank you, Dr. Arbery. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Y les voy a traer unos avances que hemos constatado para el día de hoy, ¿verdad? El Departamento de Salud Pública de Chicago agregó hoy 5 estados: Connecticut, Maine, Massachusetts, Michigan y New Hampshire, así como el Distrito de Columbia y Guam, a sus avisos de viaje de COVID-19 semanal. Vermont es el único estado que no figura en el aviso de viaje, ya que todos los demás han superado la marca de 15 casos nuevos de COVID-19 por día, por cada 100,000 residentes. Puerto Rico y las Islas Vírgenes también están en la lista. El Departamento de Salud ha actualizado su guía consultativa de viajes para alinearse con las recomendaciones actualizadas del CDC. Antes de viajar, las personas no vacunadas deben hacerse una prueba de 3 a 5 días antes de su salida para Chicago. Mientras esté de viaje, mientras esté de viaje, todas las personas, independientemente del estado de vacunación, deben usar una máscara en aviones, autobuses y trenes, en cualquier y otras formas de transporte público, mientras estén en los interiores de los Estados Unidos. En Chicago, use una máscara en todo momento en los entornos públicos cerrados, independientemente del estado de vacunación. Después del viaje, las personas no vacunadas deben hacerse una prueba de COVID-19 y traerla negativa 3 a 5 días después de su viaje y quedarse en casa y ponerse en cuarentena durante 7 días completos. Incluso si la prueba es negativa, debe de quedarse en casa y ponerse en cuarentena durante los 7 días completos. Si su prueba es positiva, aíslese para evitar que otros se infecten. Si no hace la prueba, quédese en casa entonces por una cuarentena de 10 días después de regresar de su viaje. Se aconseja a todos los viajeros después del viaje que controlen y se monitoreen sus propios síntomas para detectar si tienen COVID-19 o no. Si presentan síntomas, por favor, les recomendamos altamente que se aíslen y entonces se hagan las pruebas de COVID-19. Las vacunas de COVID-19 son la defensa más poderosa que tenemos contra este virus. Es fundamental que todas las personas elegibles se vacunen 12 años en adelante contra el COVID-19. Es una manera segura, eficaz y disponible de protegerse a usted y de todas las personas a las que ama y por ende a nuestras comunidades. El Departamento de Salud Pública continúa llevando a cabo eventos de vacunación en toda la ciudad y distribuye información confiable a todos los habitantes de Chicago. La vacunación en el hogar también está disponible para todos los residentes de Chicago. Recuerden, nuestra prioridad es todas las personas que no se han vacunado o que han comenzado su vacunación y no la han completado. La vacunación en el hogar está disponible para todos los residentes a través de Protege a Chicago Plus. Protege a Chicago at Home. Hasta 10 personas en la residencia pueden recibir la vacuna Pfizer. Si tienen niños de 12 años en adelante, también son elegibles. O Johnson & Johnson si son de 18 años en adelante. Para más información y sacar su cita el día de hoy, marque por favor al 312-746-4835 o haga una cita o visite al chicago.gov/inclinada at home para detalles. La vacuna también está ampliamente disponible a través de farmacias y proveedores de salud pública. Para darles un adelanto de lo que está ocurriendo en casos, los casos se mantienen estables. Hemos llegado a un valle. Los casos el día de hoy fluctúan de 150 la semana pasada, hoy 475. De 450 a 475. No hemos visto un avance más en las últimas 3 semanas, que es algo muy positivo. Instamos a todas las personas que se vacunen. Sí se espera que las hospitalizaciones y las visitas a la sala de emergencia aumenten los no vacunados. Recuerden, la vacunación es la protección más segura. Y con esto, pues, los dejo otra vez con la doctora Arwari para contestar preguntas. Gracias.
Thank you, Dr. Luna.
One over there and one over there. We ask that you just limit it to one question and a follow-up if needed for the first round, and if there's time at the end, we can do more. But we just want to make sure the microphones are shared.
You want to start? Good afternoon, Michelle Gallardo with ABC7. I was listening to your Facebook Live earlier, and you were talking about getting the COVID booster once it is approved at the same time as the flu shot. Mm-hmm. But is there any concern going into the colder months of a twindemic, so to speak, and how would that manifest?
Yeah, definitely. So you may recall that every year, even prior to COVID, flu season is when hospitals are the most full, right? Like, we always see a lot of people hospitalized and unfortunately die, including children here in Chicago in a typical year from influenza. So there has been a lot of worry about what is known to be an increase particularly on the healthcare system related to influenza, paired with what we have continued to see as a big increase in need for hospital care related to COVID. And so the flu vaccines we're not quite there yet in terms of launching it, but I anticipate that we will be probably promoting COVID boosters at the same time that we promote flu vaccine. And I wanted folks to understand that it is now possible to get both of those vaccines at the same time if people want to. You are also welcome to separate those. those, but it is important that everybody over the age of 6 months get a flu vaccine. It's more important this year than ever. And then obviously, if people have not yet gotten a first dose of COVID vaccine, that's the most important thing. And then if and when we get this recommendation for boosters, people should also get those on time. But we don't have a booster recommendation yet for folks who are not immunocompromised, but I expect one is probably coming shortly.
And just a follow-up on vaccination. You mentioned just now that there are 3 zip codes that have not yet reached 50% of eligible residents getting their vaccine. Who are they, and what do we think are the obstacles that remain in those specific areas?
Sure. So, we've really we've tried to set different benchmarks, and then celebrate when zip codes are able to hit it. I see 50%, meaning the majority of vaccinated eligible Chicagoans in that zip code, as a floor. 50% is not good enough, but it is an important first benchmark. So when we look at those 3 zip codes, I think and we've been working a lot, all along with our Race Equity Rapid Response team from the beginning, with our Protect Chicago and Protect Chicago Plus partners. These are the zip codes where we've been going door to door and knocking. There continues to be, I think, a lot of mistrust of government, of healthcare. I think there is a long history that these are largely Black neighborhoods, and there's a large and long and really unfortunate history of racism in government, in healthcare, and I think a lot of mistrust still remains. We also do see a lot of misinformation still being spread. People are often, you have to remember, people are always making the decision that they think is best for themselves and their family. And so they're reading something or they're hearing something that makes them scared about the vaccine or worried that the vaccine is going to be worse than the protection that can come from it. And that's not true, what we see in scientific studies, but we know that where that kind of information gets spread, people will sometimes make that decision. We don't think access is still a huge issue, honestly, just because it is very easy at this point to get a vaccine, but we do hear people, I've got obviously a lot of friends who are in clinical settings, and, I was talking to a doctor friend of mine who was taking care of somebody hospitalized with COVID, and he just said, I hadn't gotten around to it yet, right? Not that I wasn't dead set against it, and we're not seeing so much of people dead set against it as opposed to just not prioritizing it as much. And these are neighborhoods that tend to have lower income, and where people have lower income, there are other barriers that can be in place. People are worried about the side effects. They're worried about missing work. They're, worried about, how are they going to take their kid to get in and get vaccinated. There's a lot of other priorities that sometimes come to play. The at-home campaign has been very successful in these areas. We've continued to see the South Side outpace the rest of the city in terms of people being interested in this. I think where people, may have safety concerns and others, they're comfortable getting a vaccine at home in some cases more than maybe going to some of the community events. So we've really, as we've been talking to people in these neighborhoods, tried to kind of reach out and get different things the way they are. I think with back to school, we'll certainly be doing a lot of focus there as well. It gives us another opportunity to reach kids and their parents and guardians in those areas.
Dr. Arwady, what is being done to address the concerns being raised inside CPS schools about those overcrowded hallways and super crowded cafeterias and even, air conditioning not working? And what do you say to parents who are really worried that their kids are at risk for COVID?
Yeah, so, obviously, I don't speak for CPS. As the health department, we consult with and weigh in on all things related to COVID at all schools sort of here in Chicago. But what I can say, a couple things. One is that one thing that we have learned, throughout COVID, is that where schools are being careful about COVID, meaning prior to having a vaccine available, the universal masking, and then where possible, thinking about the distancing, thinking about some of the sanitation and other things that can limit risk, and doing some of the ventilation work that I know CPS has done. I don't know, I can't speak to details of individual classrooms, but I know that there was an industrial hygienist, for example, who went through every single space and did an assessment, and then they had worked on the whatever physical physical upgrades were necessary, and I know spent millions of dollars in terms of really working on those kinds of assessments, which I think are important. What we've seen across the whole U.S. is that places, even before a vaccine was available, there were a lot of schools that came completely back to school in settings and at rates of transmission that I don't think I would have been comfortable with here in Chicago. And we saw broadly that those schools were not the major sources of transmission among kids. And so when kids are in hallways and passing through, they should have masks on, as should the staff. Obviously, staff need to get vaccinated. But where we think about risk for COVID transmission, it is more likely when you are, having longer time periods, particularly that are unmasked, as opposed to some of the quicker passing through. So there's no way to eliminate risk in the schools, but I feel very strongly that the risks that we've seen, these indirect risks of not having children be in school, see some of those academic losses, but also some of the social, emotional, and other supports have really been of great concern. And so since we could have schools open safely even before a vaccine was available, working hard to make a vaccine highly available is what makes it important. There's a lot of testing available in schools too, and schools are doing everything they can here truly to work to keep these settings as safe as possible. But I'm really, I've been committed for more than a year to having kids really in person in school with the best practices that we can have available.
And I want to ask you about the changing language on the travel advisory ahead of Labor Day weekend. What does this mean for families with unvaccinated children? Does that mean that your child needs to stay home from school for 7 days?
So this is, and I know that the timing of this is a little complicated with Labor Day coming up. It will be up to individual school systems. This is an advisory, not an order, and this is the CDC advisory in the context of the worsening COVID outbreak across the whole country. There are already many school systems here in the Chicago area that have, if children were traveling to areas that were on the travel advisory, that were required to quarantine. That has not been anything that's been done universally. Schools will need to decide that. We wouldn't mandate that at a city level, but that is the current advice from CDC because the whole country is having such a major COVID outbreak at this point.
So we have to wait to hear from CPS in terms of what their guidance will be.
That's right.
And if that is in line with what your guidance is.
That's right. And we're highlighting this change, this new CDC guidance, and it is higher risk. I would not recommend traveling, right? If you've got unvaccinated children, and particularly younger children, the whole country is doing really badly from a COVID perspective right now. So, I can tell you my own sister, and, they have 3 young children who are too young to be vaccinated. They were hoping to go to Michigan for Labor Day. They're not going in the context of it now being an orange state and their kids not being able to be vaccinated. I know that's hard for people, but we're just trying to avoid infection. And I think especially when we're back in school, the bar is a little higher in terms of trying to think about limiting that risk as much as possible. But it will be up to individual schools and school systems to decide how to use that new guidance.
Okay. Lauren Petty with Channel 5. Wanted to ask you about breakthrough infections. Mm-hmm. Is the city tracking breakthrough infections by vaccine? And if so, what would the response be? There was the study in JAMA that came out yesterday, small study from Belgium, basically that Moderna produced twice as many antibodies. People who got Pfizer or J&J are probably going, oh my gosh, is my vaccine not as good? Yeah. What is your message to them?
Yeah, absolutely. So, a couple things. Number one is that level of antibody does not necessarily equal level of protection. We're the most interested in how the vaccine performs in the real world. And we know that people actually have the highest antibody level about a month after they're vaccinated. Their antibody levels then actually drop, but there's a secondary immune system that kicks in that isn't just those immediate antibodies, that is much longer lasting. So antibody level itself is certainly interesting, but it doesn't necessarily lead to significant difference in the way the vaccine is performing. What I would say is we do track cases, and particularly hospitalizations and deaths. We do obviously look at what vaccine folks have been getting. We've not seen any significantly unexpected patterns here in terms of which vaccine people have gotten related to breakthrough. I can tell you, for example, we have seen the highest number of breakthrough infections in Chicagoans who have gotten Pfizer, but that's because the highest number of Chicagoans have gotten Pfizer, not that we've seen a major difference in someone who's gotten Pfizer versus Moderna. So my biggest message is that the most important thing is that you complete a vaccine series, that you get both doses of Pfizer or both doses of Moderna or a single dose of J&J. And then as we get more information and more recommendations about boosters, that we follow that guidance. But I would not advise people to be going out and trying to get a second dose of another kind at this point. There's just not the data to support it. And there haven't been studies really looking at what some of that mixing looks like. So right now, most important thing is complete your series and be ready for when booster recommendations likely come.
Okay, and one more from our web team about the new variant. Apparently, genetic researchers have found a new variant that has a little bit of gamma, a little bit of beta. What's your reaction to that?
Yes.
Anything you can share about that?
Yeah, just that we are going to continue to see new variants. We will probably have a variant of what we call a variant of interest identified every few weeks. Like, that's how this virus works. Variants of interest just mean we've seen a number of the same genetic mutation emerge, and scientists around the world are on the lookout for it. Every single time a virus anywhere in the world gets this genetic sequence, it gets updated into a database that's shared internationally, so we can really see what's emerging. When a variant of interest emerge, it says, ooh, this is something we should watch a little bit. Once we see a variant of interest clearly have an impact, meaning it is more contagious, it might be evading a treatment, it's clearly making people sicker, that makes it into a variant of concern, the highest level. So Delta, for example, a variant of concern, especially because it is much more infectious, right? It's outcompeted. Virtually every case in the US at this point is now this Delta variant. And there actually is one higher level, a variant of high consequence that we've not had yet. So you're gonna keep seeing new variants emerge, these variants of interest frequently. Once they get elevated to a variant of concern, we start paying a little more attention to them. And I would say if something became a variant of high consequence, that would be a big deal. That would mean like the vaccine was not working very well or people were more seriously ill. So new variants should not surprise anybody. But the main thing we're watching is that the vaccines continue to protect well, which they do, especially against hospitalization and death.
Okay, thank you.
Hi. I've been watching the rates of vaccination among race and age, obviously. I'm curious about what we know about race, age, and gender together. I've been hearing anecdotally in media reports that younger black men are predominantly unvaccinated or disproportionately unvaccinated, especially compared with younger black women. I'm wondering if CDPH has any evidence or any information regarding that. People are suggesting cultural reasons about it as well. I didn't know if you guys have any demographic information, any information, from epidemiology or going out and doing field work or what you're hearing from people, that kind of thing.
Yeah, we do certainly have that data, and we look at the different ways in which they intersect. We've seen, and I don't have the exact data on that breakdown, but it's available. You can download it and look for it. What I can tell you broadly is we have seen, especially younger Black Chicagoans, that being an even bigger risk than gender is. Like across the whole city, women are more likely to be vaccinated than men, but not dramatically so. It's mostly been our biggest concern is reaching Black Chicagoans sort of in that under 30 group, is the group that is by far the most lagging. When we look at older Black Chicagoans, they are almost as likely as other race ethnicities to have been vaccinated, and actually in the oldest age group, more likely than some other race ethnicities to be vaccinated. But I think it's that younger group that perhaps doesn't feel as threatened personally by it, and also where we continue to hear a lot of people concerned about fertility, which has not been linked for men or women. There is no proof of problems with sperm counts. There is no proof of problems with pregnancy, ovarian, but that is we hear that very, very consistently among questions. And so I think it's age more than gender that's playing the major role there.
There's no statistical difference. There's significant.
Yeah, I mean, I can take a look at that. I don't know the statistics kind of off my head, but broadly, where we've looked at it, it tends to be more the age and the race together.
Okay, cool.
Mm-hmm.
Dr. Arwady, Chris Ty from CBS 2. Just another follow-up question on the return of school here. Have you seen these pictures of kids in hallways really packed in tightly? I'm wondering if you've seen them, what your thoughts are, and if you've offered any feedback or been asked to offer feedback to CPS, and if any changes need to be made.
Yeah, I haven't been asked to offer any feedback. I think, obviously CPS has been back for one day now, and may be thinking about, do there need to be changes into that? I can't really speak for them as a system. The thing I feel the most strongly about is keeping those masks on, right? And having that requirement, I think, is the most important thing in terms of limiting it, as well as the ventilation work that they have done. I think those are the most important. Might they think about other things they might? We've not been asked to weigh in on it at this point. Obviously, we're in very close touch with them whenever there are cases, really working on what that is. But the biggest risk we have continued to see, like throughout this whole pandemic, has not been the in-school. It's been the athletics and the gathering after school, and more of, even in these at-home settings. And so I know people see that and they worry, but again, a passing, even if it's crowded with a mask on, is much lower risk than the longer term when you're sort of sharing air with people, especially if they're not being as careful as they should be with masks, or they're in settings where people put their guard down. What we have seen over and over and over again from COVID is that it is settings where people let their guard down against COVID that we see the most problems. It's why risk at home has been the highest for transmission all along, where of course people have close contact without masks. So I get people's concern about that, but really the data doesn't suggest that it is the major cause at all for transmission. So we'll keep watching it, obviously, and again, I would refer any CPS specific questions to them, but I'm glad to see kids back in school, frankly, and we've seen pictures like that from all over the U.S., even before a vaccine was available. And somewhat to people's surprise, we didn't see that driving major outbreaks. There will be cases, don't get me wrong, but I expect cases to broadly track what we're seeing in the general community among COVID. There's also going to be a lot more testing of children, I expect. So in that setting, we'll probably see an increase of cases because we're doing a better job of detecting kids who may be asymptomatic or very mildly symptomatic. So those numbers will also go up for that reason. But I remain, based on absolutely everything we know, really convinced that we absolutely can be in school safely.
So for parents who hear their kids come home, they say it was a packed cafeteria, a lot of kids weren't wearing masks. What is your messaging to them who do hear this anecdotally in their own zip code and they get very nervous? Yeah. I hear what you're saying, that that's not your chief concern, but for parents, when they hear that, right, it flies right in the face of what they hope would happen.
Yeah. So, every school I know has a safety committee that's established that parents, guardians, anybody should be submitting if there's something about a specific school. I'm sure different schools are taking different approaches, have had different outreach there, et cetera. I know at a district-wide level, they've certainly thought about these things. I know there's been work to think about, space, having kids eat at the lunchroom and not all in the cafeteria, or spacing more out where is necessary. Again, one day back, I wouldn't be surprised if there may be individual schools that may be thinking about needing to make some adjustments. But I would encourage people, if they have a question related to their specific school, to reach to that school, because that will be the solving really at that individual level. But again, remember that if your kid is over 12, please get vaccinated. That is the most important thing. And rest assured that by requiring the adults to be vaccinated, by requiring the masks in place, those are really the two things that we know best about how to protect kids and have them get the learning that they need.
Dr. Arwady, if I may ask you about the indoor masking. You mentioned earlier that some businesses had been fined or cited for failing to enforce. Can you go into more detail as to what kind of businesses we're talking about and how egregious were the violations?
Sure. So the Business Affairs and Consumer Protection, I believe they actually might put a notice out about this, but I can share some of the details. So those who were given a notice to correct, that's more like a warning, where you're coming in and there's some portion that maybe are not doing it, they don't have their signs up, et cetera. That's not a fine just yet, but nevertheless, they were given a notice to correct, and then on follow-up need to have corrected that. But then the establishments that were given a citation, they include grocery stores, soccer clubs, auto stores, fuel stores, an investment place. There's a list that's available on BACP if you're interested in what some of those were. But BACP is quite focused on this. They have, in addition to the daytime, they have a nights and weekends enforcement team that goes out, to address things outside business hours, because we know sometimes that can be more of an issue. And so, even just in that first weekend, and where we get complaints in, this is one of the ways in which we're driving some of these investigations. You know, they go out and they investigate, and they really will cite if necessary. They've obviously, the goal is more to educate and make sure people come into compliance. But if you see people who are just absolutely not abiding by it, they absolutely do and have cited.
I do have one question for you that is off topic. As you know, it's Overdose Awareness Day. And I'm wondering if you could speak to the number of overdose deaths in Chicago so far this year compared to last year when we know there was a spike, and maybe the year before, which would be the normal, I guess.
Yeah. So for overdoses, for opioid overdoses, you have to kind of take a longer view. We've seen big increases over the last, I would say, 5 years in terms of opioid overdoses. But then that did significantly increase sort of 2018 to 19 to 20 again. And the largest driver of that, we believe, is that we're finding much more fentanyl in the drug supply. Fentanyl is a highly potent opioid, so it can be mixed in with heroin, et cetera. But we also are finding more fentanyl, which is an opioid, mixed in with cocaine, for example. And if fentanyl is mixed with cocaine, somebody won't have any tolerance to an opioid. Like if they're not someone who regularly uses opioids, regularly uses heroin, or regularly, abuses prescription pain medicines, they don't have any tolerance to it. And then if they don't know fentanyl is in the cocaine and they're just using the cocaine, they can have a fatal overdose, not even realizing that they have taken a very, very potent opioid. And so the biggest driver of that has been just that we're seeing much more fentanyl in it. But we are seeing, last year was a very, very bad year for us. We had, more overdose deaths than we did homicides, gun-related homicides here in Chicago last year. And this year, we've not seen major increases from last year. I think we may even be down a little bit. I'd have to check the exact numbers on it, but it's still really high and up from where we were in 2019. So we've been working at the health department with partners on a lot of new things related to overdose, making sure people have Naloxone, which is the medication that can reverse somebody who is having an opioid overdose. It can literally save a life. If somebody takes an opioid overdose, it works on their brain and it will actually slow their breathing down to the point where that breathing can stop. If you inject this Naloxone, it right away blocks those receptors and people wake back up. It's amazing to see. And we've been working to really distribute Naloxone, make sure people who have high doses of opioid prescriptions or people who are using heroin or other street medications have access to this has been really important. But we've also been working to try to decriminalize opioid overdose. So we've been working with Chicago Police Department, for example, that when people are arrested in possession of a relatively small amount of a controlled substance like opioid, as long as there's not violence associated, instead of actually arresting and booking them into the criminal justice system, they're actually being referred into substance use treatment. And that is optional. They don't have to do it. But if folks get referred in there, we're seeing people actually get into the treatment they need and be able to avoid the criminal justice system related to that. We're really excited about it. We started it as a pilot, and it's actually expanding to all police districts by the end of the year. So that's just an example of some of what we're trying. We're working a lot with hospitals, but it's a huge problem. It's one we don't talk a lot about here in Chicago, but it is linked to a lot of the other socioeconomic issues that we see. It's often linked to some of the violence that we see, and so there's a major focus on trying to coordinate the outreach work and the connection into care, because there is treatment available, not just Naloxone that can save somebody who's had an overdose. There is medication assisted treatment. There is not just abstinence, medications available that for people who have an opioid, who are addicted to opioids, can get access to medication that can absolutely help them resume their lives. And we'd love more people to get connected to and seek that treatment.
Thank you, Doctor.
Thank you.
Time for one more.
Good.
I've got several, but I'll ask. I did a piece, I looked up the figures a couple, I think last week, regarding the number of seniors who are unvaccinated on the Mid-South side. Compared to the city, state, and national averages, they're a lot higher, or a lot lower on the Mid-South side than other places. I'm wondering what this means going into the winter. I'm wondering if the decrease in the number of cases right now means that we're going to go down like a bell curve, or whether we're plateauing, and whether it's going to go up, seasonally come fall in a couple of weeks. I'm just wondering, if you could prognosticate what this 800,000 Chicagoans with no immunity figure that you gave out,
Yep.
I think 2 weeks ago means looking forward to all this kind of stuff too. I just wonder what the tea leaves are looking when they're not tea leaves. Obviously, there's a lot of data that's supporting this kind of thing, but where do we stand with the number of vaccinations going forward, and with the coming of fall, and with the Delta variant that's
Sure.
not going to go away right now,
Sure.
and the number of seniors in Chicago who are unvaccinated?
Yeah, so all along I've been saying my biggest concern are unvaccinated older Chicagoans, because we know all along they've been the highest risk, right, for hospitalization, for death, for the really bad outcomes. I would say that if Delta variant had not come, I was anticipating that we probably would have seen a COVID increase in the fall or winter, come the cold weather, just because we typically see respiratory viruses follow that pattern. There's a reason that there's a flu season and a cold season and a winter virus season, and we would expect COVID to likely follow that model. What's been interesting, though, is around the world, we haven't always seen that same weather pattern, and we're still learning a little bit about why that may be. Delta really threw this off, I think. I was not anticipating such a significant surge in the summer in the U.S. And I think an outstanding question is whether that has to do with the fact that in the southern U.S., I mean, you look at a place like Florida, people are largely indoors when it's hot because of air conditioning, as opposed to here, we're outdoors when it's warm. And so there's some question about, we know outdoor is much lower risk for transmission. So what pattern this will look like with Delta, we don't fully know, but I am concerned for sure heading into the winter. And anybody, which is why we've been starting to already talk about getting flu shots along with the COVID shots or boosters when they're available. But the main thing is anybody who's not yet vaccinated, especially somebody who's older, like now's the time, because there's the potential for it to get much worse, as we've seen it in much of the country.
And just real fast, finishing up, this market days study that CDPH is doing, can you give any information about, what you're tracking, why the study was done in place? I know 2 people that had breakthrough infections after the festival as well. Just looking for more information about that.
Yeah, sure. So for those who aren't aware, market days was a gathering in early August that is particularly a celebration of LGBTQ folks. And there had been a large outbreak in Provincetown, Massachusetts, that had seen a lot of breakthrough infections that was in a similar kind of gathering. And so we had been asked by CDC to actually pay some extra attention to this type of gathering, just to understand. And so different than ticketed events, so if you look at many of our large events, concerts, et cetera, they're ticketed. So we know exactly who has attended. We're able to require vaccination or testing, for example. Market Days is an event that is on a public street. It is open. There is not a ticketing system. We did a lot of work, like with the North Halstead Business Alliance and others, to have the businesses around the indoor spaces be requiring vaccination and testing, and they were fantastic in terms of limiting that risk. But we felt that we wanted to have an opportunity to detect, potential cases that were associated with that. And so we did have, sort of through the social media and other channels that are used, self-report form as well for people to be able to report cases in. Again, because we didn't have another way to reach them or know about them without tickets. And so, we've certainly seen cases, many cases associated with it. Nothing, not a, quote, super spreader. People are always like, is this a super spreader? Right. But we've seen cases. And so every time there is an outbreak of any kind, CDPH is always on it. It doesn't matter what the setting is in. I think in this particular one, wanted to just do a little more follow-up, given that we had seen concerning outbreak with some of the same people, in fact, who had participated at both events.
Do you know when the study's going to be out?
Oh, I mean, the epidemiologists have been, collecting data, et cetera. So I don't know for sure, but once they're finished putting everything together, we do outbreak investigations all the time. I think, if we decide to publish it or follow up, I think it'll depend a little bit what we find. Yeah.
Thanks,
sure.
everybody.
Thank you.